The same happens with inflammation of the nerve, and very often the pain is simply unbearable. The ability to quickly get qualified help is not always there, so it is useful to know how to cure the sciatic nerve at home. One of the causes of this disease is the deterioration of the vertebrae and intervertebral discs, resulting in their displacement and compression of the nerve roots. There are other factors that provoke the development of sciatica. Osteochondrosis, arthrosis, disc herniation, injuries of the sacrum and lumbar, excessive load on the spine, cancer tumors and metastases, infectious, viral diseases, hypothermia of the lower body. To cure the sciatic nerve, you must first identify and eliminate the cause of pinching, otherwise you can only reduce the pain syndrome, and even then for a while. Inflammation of the nerve often goes into a chronic stage, and one awkward movement is enough for a new attack. Symptom of disease: pinching of the nerve usually occurs on one side of the body, although it is bilateral. It is accompanied by characteristic symptoms. Sharp, piercing pain in the lower back, giving in the buttock, thigh and down the leg, numbness in the sacrum and pelvis, tingling or burning sensation, numbness of toes, limitation of motor functions, gait disturbance. Depending on the extent of the lesion, the intensity of the pain can vary from mild to intolerable. When you are in a supine position it becomes easier, may not hurt at all, but during movements there are lumbago in the area of the buttocks or sacrum. If cramping is strong, impossible to sit, walk, even to stand still obtained with difficulty. With severe nerve damage in the sacrum area there is swelling, redness, body temperature can rise. In addition, there are violations in the pelvic organs, for example, there is pain during urination, there are problems with potency in men. If there is no pinching, but a rupture of the sciatic nerve, motor functions and sensitivity of the limb below the knee disappear. How to treat sciatic nerve at home? You cannot always engage in treatment. In case of nerve rupture or severe pinching, self-treatment is dangerous for health and can lead to disability. So if the pain in the sacrum is unbearable, there is a complete loss of sensitivity in the leg, the temperature rose sharply, you need to urgently call a doctor. Medical treatment of symptoms of sciatica, as a rule, gives only a short-term result and cannot completely get rid of pain, and even more so to prevent their recurrence. Medical treatment of symptoms of sciatica, as a rule, gives only a short-term result and cannot completely get rid of pain, and even more so to prevent their recurrence. If these symptoms are absent, you can alleviate the condition of the patient with one or more medical techniques, which is worth learning more. The only real treatment of sciatica is a complex effect on the cause of sciatic nerve compression and inflammation. The only real treatment of sciatica is a complex effect on the cause of sciatic nerve compression and inflammation. First aid: pinching of the nerve occurs sharply, and it is impossible to predict it. In such situations, a person needs emergency help. The patient is placed on his stomach, choosing a flat, moderately hard surface. You cannot use a sagging bed or something unstable, so as not to aggravate the condition. For convenience, it is recommended to put a soft cushion or a small pillow under the chest. The lower back and the upper part of the buttocks need to be freed from clothing. Apply an anti-inflammatory ointment to the affected area. When the pain subsides, the patient needs help to roll over on his back, put a pillow under his lower back, and under his feet a dense roller to lift his shins. Anti-inflammatory ointment for sciatica. Anti-inflammatory ointment for sciatica. Warmers, rubbing and warming compresses cannot be done. At the initial stage it can increase inflammation and worsen the patient's situation.